Thanks very much. For many of you, I think it's a bit late for me. Someone's already got there. But for many people, they don't probably realise that there's a lot of people that actually have underlying secondary infertility. You know, they have no problems getting pregnant with their first baby and then have issues with number two. And maybe this might give you a little bit of insight into the options that are available. There we go. So what I wanted to chat to you about was some of the things that you can do before pregnancy to maximise your chances of getting pregnant, and also issues that have got to do with having a healthy baby as well. We all know that folic acid is very, very important in pregnancy. Particularly in the UK, they found that women who took folic acid had a lower incidence of spina bifida, and that now becomes the backbone of a lot of prenatal multivitamins to maximise the chances of having a healthy baby. But there are a few sort of fertility myths out there that I just first wanted to run past you. But before I get onto that, the chances of getting pregnant, not a lot of people realise that if you have a woman that's in her early 20s, mid-20s, that has normal tubes, is ovulating, her partner's got a normal sperm count, if they have intercourse at the right time, then on average they've probably got about a 20% chance of conceiving in that 1 month. So, the other 80% of the time, 4 out of 5 times, there's something wrong and the egg doesn't actually fertilise. Now, most of the time it's got to do with the quality of the egg. Women are born with all their eggs at birth, and I'll come to this later on. And as a woman gets older, there's a diminishing quality of the egg. And then with that, what basically happens is that not only is it more difficult to get pregnant, but also things like miscarriages increase, and also birth defects like Down syndrome increase with age. To give you an idea, a woman in her late 30s probably has about a 10% chance of getting pregnant in any 1 month. And then in her 40s, early 40s, it drops down to about 5% each month. And most of that's related to the quality of the eggs and the fact that women are born with all their eggs. And obviously, over those years of living, not necessarily having a bad life, but those eggs are exposed to oxygen-free radicals and radiation and herbicides and pesticides and you name it, and basically results in a diminishing in the quality. The other thing is that women tend to ovulate their better quality eggs first. So as they get older, not only are there fewer eggs there, but the quality of those eggs is less and consequently affects the chances of conception. The other thing is knowing about the fertile time of the menstrual cycle. Now, the best time to have intercourse for a natural conception is literally just prior to ovulation. So a woman normally ovulates about 2 weeks before her period's due. So if a woman's got a 28-day cycle, she's probably ovulating about day 14. And the best time to have intercourse is around about day 12, 13. So the sperm are in the fallopian tube waiting for the egg to be released. If you have intercourse the day after ovulation, there's definitely the chance of a pregnancy. But those chances are reduced to about 5% rather than 20%. So it's best if the sperm are in the tube waiting for the egg. If the egg's already ovulated and it's waiting for the sperm to arrive, it doesn't work near as well. We say to people that if ovulation's on day 14, start having intercourse about 5 days before expected ovulation and a day afterwards. Whether you have intercourse every 2 days or every 1 day makes no difference at all. The other thing also is that for women that have longer cycles, like if the cycle's like 32 days, then ovulation is going to occur about 14 days before the period, so around about day 18. So start having intercourse on day 13 through to about day 19 to maximise the chances. If you're planning for pregnancy, what can you do? It's the usual things. Smoking is bad, very, very bad for both the male and the female. There's now studies that show that men who smoke in pregnancy, it causes damage to the DNA in their sperm, and their children are 5 to 7 times more likely to develop childhood cancers compared to fathers that don't smoke. So even though the sperm's fine and can fertilise an egg, It certainly affects the DNA within the sperm and affects the health of the potential offspring. So smoking in both potential mother and father are a big no-no. The others, body weight. So obviously weight and a higher weight can interfere with ovulation and prevent a pregnancy, but it also can interfere with implantation and increase the risk of miscarriage, particularly in women with polycystic ovaries. And the other thing I mentioned earlier was folic acid. Folic acid is very important. Most people will take folic acid, iron, iodine for the thyroid, calcium, a whole multivitamin, but folic acid's the main one that every pregnant woman should take, and ideally before she starts to conceive. How common is fertility issues? Well, it's very, very common. You wouldn't think so today in this sort of conference, but about 1 in 6 couples will have some degree of difficulty in falling pregnant. And that increases with age. So women who are in their later 30s, that number becomes much more significant. It's equally divided as to whether it's a male factor or a female factor. Most of the time we think it's female related, but it's not. It's both male and female. And a lot of the times it's unexplained. The issue with unexplained is usually for most people, structurally things are normal. The woman has a regular menstrual cycle, she's releasing her eggs, her tubes are okay, her partner's got a normal sperm count. But for whatever reason, the quality of the sperm or the quality of the egg, a pregnancy is not occurring. So unexplained infertility is quite common and it increases with age, and it's usually got to do with egg and sperm quality rather than a structural abnormality. As I mentioned, women are born with all their eggs at birth. The maximum number of eggs peaks at about 6 months in gestational age, and then by the time that a woman gets to puberty, those numbers have dropped down to about 400,000 eggs, and then she'll use those eggs during her reproductive life. What normally happens in any one menstrual cycle, there's probably about 30 or 40 eggs that start growing about 3 months beforehand, and in that 1 month where she ovulates, out of those 30 eggs, 29 die, one of them matures and she ovulates. So even if a woman is on the pill, or if she's pregnant, or if she's breastfeeding, there's still this cohort of 30 eggs or so that are growing through, have started growing 3 months ago. And then by the time it gets to ovulation, if she's not ovulating, those 30 eggs are still dying. So being on the pill doesn't protect against things like early menopause. Because there's a constant attrition of eggs. There is a blood test that we can do that looks at egg numbers that people may or may not know about, called an AMH level or anti-Müllern hormone level. And basically it's a hormone that's produced by the little follicles within the ovary. And the more follicles that the woman has, the higher the AMH level. The only problem with that test is it doesn't tell you anything about the quality of the eggs. It only tells you how many eggs that woman has relative to other women of a similar age. But an AMH level is a common test that we do on couples having difficulty in falling pregnant. What about the boys? Well, interestingly enough, sperm count changes quite dramatically from week to week. So this is a slide of a study that was done in the US, where basically they had a gentleman in a US penitentiary, and they got him to provide a sperm sample on a weekly basis and plotted it out. And you can see it changes quite dramatically from week to week. Sometimes the sperm count might be as low as 2 or 3 million sperm per mil, and other times it's as high as 170 million sperm per mil. So sperm production is not constant, it does vary. And if anyone has an abnormal sperm test, then the best thing to do is to repeat it, but not straight away. Repeat it sort of about 6 weeks later, because sperm take about 72 days to mature. So if the sperm count's not good and you check it again straight away, you're only going to get exactly the same result. Life cycle of the sperm. So from a fertility point of view, what do? If couples are having difficulty getting pregnant, the first thing is for them to see their GP, particularly if there's an irregular menstrual cycle. If the cycle's irregular, we don't know whether ovulation is in fact occurring. Or the other difficulty is with an irregular cycle is having timed intercourse. Can be difficult to predict when ovulation's occurring. If the cycles are regular and everything's healthy, in both parties. We normally recommend if you're less than 35, if you're not pregnant after 12 months, is a good time to go and see your GP to do a few more tests to try and work out why. And the second thing is that if for women who are over 35, because of their diminishing egg quality and age, that if they're not pregnant after 6 months, it's probably not a bad idea to do a few tests to try and work out what's going on. Not necessarily meaning that you need to do any treatment, but at least to make sure that you're not wasting your time and everything's okay. Alrighty, on that point, fairly short sort of talk on fertility and preconception. But the biggest thing I would say, though, from a health point of view, and even those of you that are lucky enough to be pregnant with number 1 or number 2 and may want a second child, the health of the mother prior to that she gets pregnant is very, very critical. There's a thing now called the Barker hypothesis that they talk about in medical terms, and women who are overweight, who smoke, even though it doesn't cause damage, structural damage to the DNA, it alters the way that the DNA is wrapped or encapsulated within the cells. And we're seeing that people who are unhealthy before they get pregnant, their children are at a much higher incidence of health difficulties later on in life, things like diabetes, asthma, and the like. So prenatal health is critically important. And if you're lucky enough to be able to plan your pregnancy, then planning to be in optimal health beforehand certainly has a big impact on the potential health of the offspring.